Good morning, good afternoon, good evening, everyone. Welcome to today's webinar titled Building Competencies for Climate Conscious Pharmacy. Today, 7th November 2025. My name is Chima Amadi. I'm here with my colleague DG21, which is Sustainability in Pharmacy Practice Global Lead for FIP, and my colleague Lizette Ezenekwe, who is from Nigeria, who's also a co-fellow DG. So both of us will be moderating this session this morning. So a little bit of housekeeping rules. This webinar is being recorded and live streamed via YouTube. This recording will be available on our website at www.events.fip.org. You may ask questions using the question box provided below. You can see the Q&A function. And you're also welcome to provide feedback to these webinars at fip.org in case of you have comments or suggestions on how we can improve on our webinars or on our digital events. Please use the email address webinars@fip.org to provide that feedback. Then, of course, we welcome you to become a member of FIP. We need more members, individual members like you, to actually be playing more active roles within the FIP. Join us at www.fip.org/membership registration. It's also worthy to note that all the information here are confidential due to data protection policies you must comply with and cannot be copied. Right. So also to mention that this webinar there's a translation feature on Zoom in case of course, this webinar will be delivered in English. So for our non-English speakers who are attending these webinars, please, we have a translation function to translate into, gives you different options of how you can translate this webinar to your language of choice. So step 1, as you can see on the image here, turn on the captions. So step 2, enable the translation toggle. Choose step 3, choose your preferred language under my captions language. And then, of course, you can now, after you do step 1 to 3, you can now follow along with live translated options. Next slide, please. So, having said that and done the housekeeping, so my name is Chima Amadi once again, with my colleague Lizette. I will have 3 wonderful speakers and panelists. Today, we have Rafa Al-Khalifa, Associate Director, Altica Specialty Pharmacy Services UAE. We also have Dua Mohammed Suleiman, Research Fellow, Mohammed bin Rashid School of Government UAE. And then, of course, we have Mina Al-El, Advanced Pharmacy Practitioner, South Tyneside and Sunderland NHS Foundation Trust UK. So we'll be hearing from our 3 wonderful specialists soon. Also, to mention about FIP sustainability in pharmacy, so we have 3 different areas of sustainability in pharmacy practice. So we have the first part of environmental sustainability. Of course, we have to work hard as pharmacists and contribute our knowledge and expertise to support the quest towards environmental sustainability. And then you also have the economic sustainability part of it, because in terms of tying the economics and sustainability and climate, they're all intertwined. And of course, the social sustainability in terms of social justice and social implication or applications of how sustainability cuts across both climate and our pharmacy practice in this case. So FIP sustainability in pharmacy practice examines the intersection between each of these 3 areas and of course pharmacy practice. Next slide, please. Okay, so just to mention that we have so part of the resources that we have, so you can always check our resources out. For example, we have the FIP statement policy titled Sustainability of Pharmacy Delivered Professional Services through Viable Remuneration Models. You can also take a look at our digital events, like on our World Environmental Digital Events, which is the healthcare professionals supporting environmental efforts. I can also look at our digital events titled Ethics of Sustainable Healthcare, so you can also look that up. And then we'll have a document on sustainability of pharmacy services advancing global health. So these are resources available to you within the FIP that you can look at and help you in this journey about embedding sustainability in your pharmacy practice. Right, so we are done with introduction. So the next step now will be to, so first item here is introduction by moderators, which I've done. So the next step here will be the overview of CARES guide by Rafa and Al Khalifa, then followed by panel discussions and Q&A, which will be done by our two beloved panelists, Dua Mohammed Suleiman and Mina Nae, which I've introduced earlier. And then, of course, we'll have our closing and next steps. Next slide, please. So there are three key learning objectives here, which we'll look at. So the first one is we need to recognize the role of pharmacists and pharmacy teams in achieving environmental sustainability. So we need to highlight what pharmacists and their pharmacy teams can we do to achieve environmental sustainability. So we need to learn the steps we need to take, how to go about that, and the key role, our position within both our patients and the wider community or the local population that we serve to achieve environmental sustainability. The second objective here is we need to understand the key knowledge and skills outlined in the reference guide for sustainable pharmacy practice. So we need to understand what the key knowledge and the skills. So the FIP reference guide in terms of how this can be applied to achieve sustainable pharmacy practice. Then the third objective here is to identify opportunities to integrate sustainability principles into education, practice, and policy. So in the areas of our practice, we know be able to equip us with the skills and knowledge on how to identify areas within our workplace or within our areas of influence where we can integrate sustainability principles into, for example, those in academia for education or in practice, or even our colleagues in regulatory and also in the government. Next slide, please. Right, so today will also be an opportunity where we are launching our FIP Knowledge and Skills Reference Guide for professional development in environmental sustainability. So it's a call to action for pharmacists for environmental sustainability. So this Knowledge and Skills Guide, Reference Guide, was developed by a wide range of pharmacists within FIP and beyond who are knowledgeable, who have contributed in their own area of sphere, coming together to develop this Knowledge and Skills Reference Guide. So today will be the launch, and it will be interesting and to be very much impactful for we as pharmacists to look at this knowledge guide and also learn a thing or two on how we can advance sustainability, environmental sustainability within our area of practice. So watch out for this Knowledge and Skills Guide, and we'll be talking about it much later in this webinar as well. Next slide, please. Right, so without further ado, I want to hand over to one of our wonderful panelists, Rafa Al Khalifa, to put us through about the FIP Knowledge and Skills Reference Guide for professional development in environmental sustainability. Welcome, Rafa. You have the floor. Thank you very much.
Thank you, Chima. Good morning, good evening, good afternoon, everyone, everywhere. Today, I'm excited to present to you the FIP Knowledge and Skills Reference Guide for Professional Development in Environmental Sustainability, which represents a critical step forward in addressing one of the most pressing challenges of our time today, the environmental impact of healthcare. So let's dive in. My name is Rafa Al Khalifa, and I currently serve in several roles to align with my vision and mission. I'd be happy to connect with you all on LinkedIn, and today I'm presenting in my capacity as an intern with the FIP's Sustainability RX program. So let's move to the next slide. Now we will be starting with setting the context by sharing some statistics that highlight why the guide is so urgently needed. So healthcare emissions have increased significantly by 36% since 2016. Today, healthcare is responsible for 4.4% of global greenhouse gas emissions. To put this in perspective, and based on the Healthcare Climate Footprint Report or paper, if healthcare is a country, then it will be the 5th largest emitter in the world. Within healthcare, pharmaceuticals and hospitals are the largest contributors, accounting for 63% of all healthcare emissions. So if we take UK, NHS, for example, pharmaceuticals alone represent 25% of total emissions. As pharmacy professionals, we are at the heart of medicine production, distribution, and use, and this creates a responsibility and opportunity to drive change. Next, we will be now seeing what is the purpose of this guide. So simply put, it's designed to support professional development and help integrate sustainability principles across pharmacy practice globally. This isn't just a theoretical document, it's a practical resource for real-world application. The guide is intended for a wide range of stakeholders, pharmacists and pharmacy team who are in the front line of patient care, then educators and trainers who shape the next generation of professionals, and then policy makers and regulators who establish the frameworks, standards, and policies, and industry stakeholders who manufacture and distribute medicines. By addressing all these groups, we are taking a system-wide approach to sustainability in pharmacy. Next, this guide does not exist in isolation. It's deeply aligned with the FIP's existing global frameworks. It links directly to the four clusters of the FIP Global Competency Framework: the pharmaceutical public health, the pharmaceutical care organization and management, and professional and personal competencies. Additionally, it supports three key FIP development goals: DG5 on competency development, DG10 on equity, and most importantly, the development goal on sustainability. Other development goals could include 18 about accessibility and DG9 about continuous professional development. Next, now let's look at how the guide is structured. So the content is organized into three main categories. First, we have core topics. So core topics are the foundational knowledge and skills on mitigation and adaptation that all pharmacy professionals should possess, regardless of their specific roles or setting. The second is the specialized or advanced topics, and these are for professionals working in specific pharmacy sectors who need deeper expertise. Third, we have the broad topics about the successful stories and cases and FIP certification programs and so on. The guide addresses four distinct pharmacy sectors: clinical practice, industrial pharmacy, academic pharmacy, and policymaking. This structure makes the guide flexible and adaptable to diverse professional settings and career stages. Moving to the next slide, we will be diving deeper in the two strategic pillars that work together to create a comprehensive approach to sustainability. The first pillar is mitigation, which is reducing environmental impact. It involves reducing greenhouse gases emissions, preventing pollution, minimizing medicine waste, implementing sustainable practices in daily operations, and focusing on preventive care to reduce overall medication use. The second pillar will be about adaptation, and it's building climate resilience. It focuses on ensuring equitable access to medicines despite environmental changes, maintaining service quality under stress and pressure, supporting vulnerable population who are extremely affected by climate change, developing climate resilient supply chains, and building emergency preparedness capacity. These two pillars are complementary and both are essential. Mitigation addresses the root causes of environmental harm, while adaptation ensures that pharmacy services remain sustainable, accessible, and effective in changing climate. Moving next to the diving deeper into the core competencies for mitigation, organized into knowledge, skills, and attitudes. Knowledge Pharmacists need to understand environmental impacts across the entire medicine life cycle from manufacturing through disposal. They should be familiar with green practices and regulations, understanding digital sustainability, and recognize how different medicine formulations impact the environment. Skills: this means being able to communicate effectively about sustainability with patients and colleagues, implement smart inventory management to reduce waste, or optimize infrastructure for energy efficiency, and develop effective waste management programs. Coming to the attitudes, perhaps most importantly, pharmacists need to embrace an environmental stewardship mindset. So they must recognize sustainability as a quality indicator, not separate from like the quality of care or the good care, but integral to it. And they need to commit to continuous learning as this field evolves. Going to the adaptation in the next slide. Yes, so knowledge: pharmacists need to understand climate health connections, how rising temperature, air pollution, and extreme weather affect the patient health. They should be aware of vulnerable and high-risk population, understand supply chain resilience, integrate air quality information into practice, and engage with public health initiatives. Going to the skills, this translates into crisis response management during environmental emergencies, providing patient education on environmental health risks, conducting health screening to identify at-risk populations or patients, applying this knowledge in clinical practice, and collaborating across disciplines. Finally, the attitude for the adaptation: it includes behavior change leadership, helping patients modify behaviors to protect their health, maintaining compassionate care even under stress, and advocating for community health equity. Then, now, education is definitely critical to making this vision a reality, and there is good news here. Research shows that 91% of pharmacy students plan to advocate for sustainable practice in their future careers. This demonstrates tremendous enthusiasm among the next generation. But the issue is that, and it's very crucial, that while the motivation exists, significant knowledge gaps remain. So many students and practitioners want to act, but they do not know how to do that. This creates both an opportunity and a need for educational reform. The guide outlines several key strategies: integrate sustainability into pharmacy curricula across all courses, not only as a standalone module; provide emergency preparedness training so pharmacists can maintain service during climate-related disasters; and develop regulatory frameworks that embedded environmental responsibilities into professional standards. The last one, and not the least, the FIP seal for quality programs. It recognizes and promotes excellence in sustainability education. By implementing these strategies, we can close the gap between motivation and capability, ensuring that these 91% of students who want to advocate for sustainability have the knowledge and skills to do so effectively. Moving to the last slide almost as we wrap up, pharmacists are uniquely positioned to lead sustainability efforts. We touch every aspect of medicine life cycle. We are trusted healthcare professionals with daily contact with the patients. We are scientific experts who understand pharmaceutical impacts, and we are often community leaders who can influence behavior at scale. Moving forward requires action on 3 fronts. First, integrate knowledge and skills into practice. Use this guide to assess your own competencies and identify areas for growth. Second, advance education. Whether you are educator, student, or practitioner, advocate for sustainability education in pharmacy programs. Third, enable policy change. Work with the regulators, policymakers, and professional organizations to create a systemic change needed to support sustainable pharmacy practice. Together, and I emphasize together, we can reduce healthcare environmental footprint while simultaneously improve patient care. Thank you so much for attention and listening today. And I encourage you to scan this QR code to learn more about that, and looking forward to the panel discussion. Thank you. Back to you, Chima.
Thank you so much, Rafa. That was quite a wonderful presentation. So thank you so much. So at this point, I would like to hand over to my colleague, Lizette Ezenekwe, to lead us through the panel discussions and for the questions as well. So Lizette, over to you. Thank you very much.
Okay, thank you. Is it me?
Yes, please.
Thank you all for joining in, and I'm happy. I hope I'm being heard. Somewhere like network wasn't so strong, but we're fine now. Oh, thank you all. So I will want to start with the questions so we can move on. For the first question, we have: what makes this guide particularly timely and important for the pharmacy profession and the wider health public sector? I repeat, what makes this guide particularly timely and important for the pharmacy profession and the wider health sector?
I will start. So thank you everyone for this opportunity. My name is Dua Mohammed. I'm a pharmacist and public health policy researcher and planetary health advocate. So the guide really is very necessarily, as Rafa already spoke about, how the global health emissions and how the health now is greatly contributing to this kind of pollution. So we need really to act quickly in it. So it is not a matter of like a problem that will happen in the future. No, it is currently happening, this issue, and we need to act now. And I think as all pharmacists, what we are lacking is the know-how. We might have the knowledge, we know that there is issues, but we don't have the blueprints to help us. So this guides really serves as a roadmap for most of the pharmacists in different industries to act urgently and quickly in these issues.
Thank you so much, Dua Mohammed. Am I having any other reaction? No. I think I should go ahead to the second question. Okay,
I can add to that as well as it. Hello, I'll just introduce myself. I'm Minna. I'm a hospital pharmacist based in the UK. I'm also the lead author for the RPS, the Royal Pharmaceutical Society Greener Pharmacy Guide. I'm just going to post the link in a chat if anybody wants to check it out. Alongside the launch of the FIP Knowledge and Skills Framework today for sustainable pharmacy. So the question was why the guide was particularly timely. I think Dua summed it up really nicely. Since the COVID pandemic, I think emergency preparedness and importance of public health agenda has never been more, forefront of everybody's mind. So there's no need to explain that in terms of climate emergency. If we're not prepared for it, then we will be the ones to suffer, the end of wildfires, intensity of typhoons and storms are increasingly globally. And the question about why it's particularly timely, I think we should have published this guide many years ago. And a lot of countries are maybe behind, and a lot of countries are maybe ahead. So this guide serves as a standardized method of everybody getting on the same page. And we can share good practice, learn how to practice sustainable medicines together. And this guide is meant to provide that.
Thank you so much, Minna. Is there any other reaction for these questions, or we go ahead? So if you want to answer a question, you can just use the reaction board so we can know you want to speak, so we can give you the option to speak. Thank you so much. I'll move on to the second question. What are the key barriers preventing the translation from intention to action, and what enablers can help overcome them? I repeat, what are the key barriers preventing the translation from intention to action, and what enablers can help overcome them? Thank you.
So I might start. So from like a policy perspective, because I worked little in the policy area, sometimes when there could be different policies, but they are not really enabling for this kind of issue. So sometimes there is no incentives really for pharmacists to do any kind of sustainability. It will be like add on onto their job, what I will get in return if I was doing this kind of things. So this is one of the things that I guess I felt from my practice. Also the awareness somehow, especially the educations, we still somehow we are focused on the regular traditional pharmacy educations. There is not much expansion, especially in the bachelor degree. Maybe after in the master or in the PhD, you will learn more about, but in the core and in the bachelor, you will not learn a lot about this. And also, I think one of this is what like the kind of the issues in the awareness in time of policy and in time of the economics of having this. So it's mainly this is what I'm seeing. Are the kind of the barriers. I don't know if Mina have anything to add.
I think we are exactly the same as you do. And when there's not incentivized, it is like asking our pharmacy staff to do an additional task. But I think it's how we frame it. So in the UK, we're trying to explain to people this is not something additional we want you to do. This is looking at what you already do and how to align that with sustainability. I think the barrier probably here is every pharmacy is different in a worldwide, and every pharmacist job description is different worldwide. So to create a standardized framework that applies to everybody is already a difficult task. So I think this guide just provides kind of the general thing that most people are already working on, and now we're all trying to get on the same page. And so the things that we talk about in a guide is not something new, at all. So things like deprescribing, reducing waste, counsel on kind of polypharmacy, these are not new things. We have been doing that for decades. But what is kind of new-ish here is framing that conversation with our patient to say, we don't want to create waste. Tell me what you don't need. Tell me what you don't need to order. We will have that conversation. If you don't want to have it, we don't want to generate waste. We don't want to burn more medicines in, incinerate them and to cause more carbon. So a different way of communication, I suppose, is one of the barriers that we need to learn. And I think one of the barriers also is appraising, information out there. So there's a lot of, if you haven't heard of the term greenwashing, so, companies say they are sustainable, but actually, what does that mean? And pharmacy teams are not equipped to appraise that information in terms of your procurement of a sustainable supply chain. We talk about scope 3 carbon emission data, but what does that mean it's not in a curriculum like do I say in your bachelor or your basic pharmacy degree. So how then you then translate that to applying the policies in your local area will be, I think, one of the key barriers that we face initially.
Yes, I totally agree with
Okay,
you.
thank you.
If I may add here to this question, also I echo Dua and Mina, and I'd like to add regarding the digitalization. And by the digitalization, I mean that like the effective and responsible digitalization or digital tool use, because and it's also highlighted in the guide that the digital tools itself, it can add to the carbon emissions, and it can worsen the case, but if used incorrectly or with redundancy. But if we use it responsibly, and we truly shifted or transformed our systems from the regular manual and documentation and a lot of paperwork into digitalization in the proper way, that would decrease a lot the carbon footprint contribution from the healthcare. So I just wanted to highlight this point about the digitalization and how it can be a barrier and also enabler in the same time.
Thank you so much, Rafa Al-Kaifa. Thank you. Thank you, Dua. Thank you, Rafa. So let's go on to the third question. So can panelists share examples of how the strategies might look different in high income versus low and middle income countries?
I can share, like here in let's say in the UAE, most of they are focusing really in sustainability. There is different procurements strategies for sustainability, and there is also the net zero policies, and different things are happening. Uh, that there is focus, there is shift, but when we comes into the low income countries, the focus really in access to medication. We need first medication, then we think later about sustainability. So how we can first ensure that we have the supply of medications, it is not interrupted the supply. Also that this is what, especially in fragile settings, this is the main thing and the main focus there. But if we look in both ways, in whether high or lower income countries, both are looking for resource efficiency. At the end, they want to have the best resources in the lowest cost. This is the target mainly for both, whether it's high income or low income, they are focusing in the resource efficiency, but is how the methods is different between both setting.
And then I think I can add to
Thank
that
you.
in terms of Dua's comment is as well, but the difference between a high income and low income country, I think high income will be able to adapt very quickly to the impacts of climate change, whereas low income, where is the help going to come from? So I think in terms of practicing environmental sustainability, the low income countries probably will have a bigger focus on adaptation compared to high income, and high income countries are wasteful. We are, single use culture, and there's a lot that needs to be happen to enable staff and patient behavior change, to change their wasteful behavior. And then there also needs to be an investment in we see loads of implementation of solar power, electric vehicle charging now in pharmacies within the UK. But without additional investment, that will not happen, especially in the remote areas where there is not even a basic public transport infrastructure for patients to get to their medicine. So never mind installing, electric vehicles. So there's different areas and to consider locally what your priorities should be. But yeah, I think majorly the difference between high income, low income is one would be focused on mitigation more than, and one would be adaptation.
Oh, okay. Thank you so much, Mina. Thank you also, Dua, for that. Okay, Rafa, thank you. Go
Yeah.
ahead.
Yeah, I just want to add on that, following to the answers of my colleagues. So, yes, as Mina highlighted, like the high income countries would be focusing on, or would be more able to invest on that. So we can speak about structuring structuring the educational programs, like innovating in that area, so that the experiences can be transferred easily to other countries and so on. And currently, when we did the literature review and discussed with experts from different countries, this has been very clear. Like in some countries, Canada, UK, and so on. But for the low income countries, as Dua highlighted, like it's very essential now to focus on the accessibility, and part of that, as she mentioned, the supply issue. So emergency preparedness is very essential. So the pharmacy teams needs to be very careful and be very well trained on the emergency preparedness. And this actually we have witnessed that with the floods and the stuff, like how things can just in one day get, the healthcare systems can be collapsed and so on. So emergency preparedness in low income countries it's a very needed area to invest in. Thank you.
Thank you, Rafa. Thank you so much. So move ahead to the next question. Okay, now the guidelines outlines comprehensive knowledge, skills, and attitudes needed for sustainable pharmacy practice. Looking ahead, how should the profession measure progress in developing these competencies? I repeat, the guide outlines comprehensive knowledge, skills, and attitudes needed for sustainable pharmacy practice. Looking ahead, how should the profession measure progress in developing these competencies? Thank you.
I think we need to measure it in all level. So we have to measure in individual level and an institutional level and in a policy levels. So in individual levels, we know there is a different pharmacy competencies they should have, and they are measuring the workplace in a very regular. So one of these should be this the sustainability, different skills, competencies should be measured as we are measuring the pharmacist medications, skills, counseling skills. There should be sustainability skills. When we talk about institutions, we know we're talking about indicators, and there should be kind of clear indicators on what we are measuring. It should be like somehow transparent, like this KPI. Are we measuring like how much waste coming from medication? So there should be kind of indicators. Policy levels also we have to measures in different, what is there is even a policy framework is in the place available or not about the sustainability. So these three levels I think we have to check every time and ensure like it is now it's like a part of culture. It is not something new. We have to keep auditing it as we are having, we always say medication safety, we should say sustainability. So it's part of the culture now, as we always saying that medication safety, this is something by default we have all understand. So this is, I think, the accountability.
I think to add to that as well, you were asking how do we measure progress. So I think there's a lot of toolkit out there currently. In terms of pharmacy, for example, I'm just going to post another link in the chat. This is called the Planetary Health Report Card. This is pharmacy students assessing whether their university are teaching in their bachelor degree elements of environmental sustainability within their pharmacy degrees. So they come out with a report card, A, B, C, D, E, on how good they are, and then they try to improve and influence the curriculum to include environmental sustainability. And as part of the Royal Pharmaceutical Society Greener Pharmacy Toolkit, the link I posted in the chat earlier, that is a self-accreditation scheme for hospital and community pharmacy to accredit yourself as bronze, silver, or gold level sustainable pharmacy. And we have a lot of pharmacies engaged already and that accredit themselves and started on the journey. It's more to raise awareness and then accredit yourself and try to be one better in terms of how you track your progress. And I think also in terms of co-benefits, I think it's important to track that you're reducing carbon, and it's good that you're tracking how much pollution you're mitigating. However, the one selling point so far I feel like is cost saving. So if you are able to demonstrate most of the time, if you're reducing carbon, you're reducing the cost of running your pharmacy services as well. And obviously you can redirect that money investment to something else in your pharmacy business. So if you're able to demonstrate the benefits to the pharmacy staff as well, that will also be something you should measure. So, not just carbon and pollution, but also what is the benefit to the business in terms of financial and well-being of staff as well.
Okay, thank you so much, Nina. Thank you, Dua. Do you have any other questions for that? Do you want to respond to this? Okay, thank you. Let's go ahead to the next question. Okay, what accountability mechanisms from individual practitioner level to national policy level will ensure this isn't just aspirational guidance? Now, I repeat again, what accountability mechanisms from individual practitioner level to national policy level will ensure this isn't just aspirational guidance? Thank you.
I can start with that one maybe. So accountability mechanism individual level. I think on an individual level, a lot of us wait for instructions, and that is how hierarchy works. You're given a task by your boss, your chief pharmacist, your line manager. So if you're waiting for a task about sustainability, you'll probably be waiting for a long time. So on an individual level, I feel like you should research the topic very well in terms of any quality improvement that you're trying to do. Use the guide published by FIP and align that with the global policy, if you like, and then just go go ahead and crack on with it and start the project and then demonstrate, your carbon reduction, your benefits in terms of financial for the business, etc. So individual level, I feel like you should gather your own green network, if you like, green champions, and work with them. And so far, I have had so much support from non-pharmacy colleagues. Sustainability is a really powerful value to connect people outside pharmacy, to connect with doctors, nurses, physios, etc., to work on a project together that you would never think of. On a national level, individual countries, I can't speak for, but within the UK, we have specific metrics and measures that is monitored by the national, they're called the Greener NHS, so the Greener National Health Service unit. It's kind of a sustainability development unit where they are tracking, kind of how different organizations are meeting the targets set to meet net zero by 2030 or 2040. And then there are non-healthcare analysts, a big team to measure the progress of different organizations, including pharmacy, on how they are progressing towards that, highlighting good practice, sharing good work, and also sometimes incentivizing their sustainable projects as well. And do I just have something to add?
No, I think you fulfill that. And also it's important to like benchmark. Sometimes if you don't know where exactly you are, it's better that you benchmark with other countries and other regions. Maybe it is within, let's say, the Gulf region, they can benchmark within themselves because they have the same context. So the countries with the similar context, it's better like to have a certain benchmark with them so that it's easier. And also if we have like institutions have certain like dashboards that will show their progress, it will be also beneficial for this. So it is I believe also for individual level, as you said, Nina, we have to start now with a small. What do you have in the pharmacy in your current workplace? What exactly now is they are using like still the printer machines? Can you change it to the digital? We don't want really like radical solutions. Start with what you have in the fact where we are working in pharmaceutical sector. You can have a small pen in the pharmacy for return medication. What you can do now, just act now, and later on this will progress to bigger impacts. So this is the thing that we have to think in a very simple way so that we can achieve.
Thank you so much, Dora. Thank you, Min.
Thank you.
Can we go ahead? Okay, thank you. No more comments on this. Okay, for the final questions I have, how should we measure progress and ensure accountability in implementing these sustainability competencies across all levels of pharmacy practice? And I repeat, how should we measure progress and ensure accountability in implementing these sustainability competencies across all levels of pharmacy practice? Thank you.
I think I've given similar examples already to the previous questions where some of our UK pharmacy schools are benchmarking themselves against the Planetary Health Report Card to see which pharmacy schools have included, a climate change module within their curriculum, for example, or how to discuss in terms of respiratory health, what is the impact of air pollution on their COPD, on their asthma, and how to reduce exposure to that will improve your respiratory health. So conversations like that, if you're having, and then that cascades even more in terms of the national metrics we're measuring. The two things that we're currently measuring are anesthetic gases used in hospitals and inhalers, because they are the two largest pie chart of emissions in the UK. So you kind of really need the analysts if you really want to drill down to details of carbon footprint. And then in terms of pollution data, I suppose if you want to start a research project or a PhD, and I know of two PhD students are in their third year on sustainable pharmacy, and then I've just spoken to one in Ireland yesterday about his toolkit for community pharmacies in Ireland. So there are growing numbers, and if no one in your country is doing this, you need to be the first one to benchmark to make sure that there's somebody is progressing this work, because globally we are all having to move towards some sort of measurement to ensure we're playing our part and the fair share in reducing our emissions and pollution.
Thank you, Dora. Rafa?
I have nothing to add. Thank you.
Yeah, I just have one point to add, from the answers of the previous questions and this question. There is the Data and Intelligence Department under the FIP. So data is power, and I believe, to improve the quality of sustainability practices, and also to measure the improvement in this area, or in this DG development goal. I believe they have started working on gathering all the member organization of the FIP, all the data coming from the member organizations of the FIP and their different development goals, but not the sustainability. So I think if the Data and Intelligence Committee started gathering data about the sustainability, this would be a very good resource for the member organizations in the FIP, and also it would be good to publish it further in order to strengthen this area, because as my colleagues highlighted, it's the data is still, you can say, immature or poor a little bit. So I think data is a very important area to work on. Thank you.
Thank you, Rafa. You have anything to say?
No, thank you. I think my colleagues covered all the points.
Okay, can I have a final message from Rafa, Mina, and Dua?
Sorry, Lizette. I think we have a couple of questions. Yeah, sorry. I think we have a few questions in the chat. So maybe if our panelists can just maybe go through it. So I'll just read them quickly. Thank you so much, Lizette. I can just go through the questions and then we round up. Thank you so much.
Thank you, Chima. Thank you.
Okay, so thank you so much, Dua, Mina, and Rafa. Thank you very much. So we have a few questions here. Maybe for 30 seconds, I can just go through the questions before we go. That would really be helpful. So the first question here from our audience is from Saeed. He's saying, is FIP planning competency frameworks for developing countries regarding sustainable pharmacy? Maybe Rafa, do you want to comment on that? I can also add to that as well.
Yes, so for the environmental sustainability, our guide, it's we have developed it in a way that is going back to the literature, and also we consulted people. We tried to ensure that we are consulting experts from different continents and different countries with different income level and so on. So I believe when you see it, you will feel that it's comprehensive. Some of the data would be applicable to each area, and some of the data will be relevant to other areas of the world. So I hope that you find the guide helpful, and I believe the Sustainability RX team are growing and improving day by day. So you can look out for further reports and detailed material on that area. Thank you.
Thank you so much, Rafa. Thank you. That was quite concise. I think you've said it all. So the second question quickly for Mina. Mina, you can really give us an insight into this one. What are the key skills pharmacy students should learn for climate responsive healthcare? Maybe you can give us some insight from the UK perspective, what you think around that. That would really be helpful. Mina?
I think it's probably understanding what sustainable medicines use and actually what we're actually saying when we're practicing environmental sustainability. Because from experience, every time I talk about the subject, people think, oh, plastic and inhaler recycling, or plastic so much. We have to put the waste in the right bin. Actually, it's not that. So, for example, right, if you can understand the power of pharmacists in terms of preventative health and public health, encouraging vaccinations, for example, encouraging weight loss management, encouraging. In the UK, there's a boom of weight loss jabs, so reducing weight. In terms of managing that, you prevent long-term diseases, chronic diseases from developing, and you prevent hospital admissions, which are an enormous carbon footprints in the future down the line. So you're preventing the use of polypharmacy medication to manage these chronic diseases by doing preventative health in the first place, so public health. So it's all of that. in conversations about de-prescribing, it is not, the doctor prescribed this, therefore I must have take this every day. If the patient is not taking it, they're not taking it. And then pharmacists should, I have a feedback from conversations from pharmacy business before, but you want our pharmacies to fail by like not dispensing the medication. Actually, we need to remodel how our business work these days. It's not about dispensing volume anymore, or at least like in the UK, we're moving towards services in terms of selling, like I just outlined, weight loss services, travel vaccinations, for example. The money is coming through a different way. And I think globally, we should move towards that. It's less about dispensing volume and pharmacy doing a robot job in the future. And I think pharmacy also in terms of pollution and the green chemistry for use in pharmaceutical supply chain is, if you're interested in industry, for example, understand how to procure sustainable solvents, sustainable APIs, and what does that mean? And again, going back to being able to appraise data, and which is currently not taught at all. So I have to teach myself a lot of these things. I did a master's in environment and human health after my pharmacy degree, just to understand all of this. So, but then should it be embedded, in curriculum right now? And who is it to do it? It's everyone should be thinking about embedding it now, not like, 5 years, 10 years time.
Thank you so much, Mina. That was very much explicit and straight to the point. Thank you very much. I'm conscious of our time, so we'll just run quickly. So Dua, this one is for you. How can pharmacists incorporate climate competencies into geriatric polypharmacy management, like recommending eco-friendly geriatrics for elderly patients in heat-vulnerable Asian cities? So can you give us a context from the UAE? That would really be helpful. Thank you, Dua. Over to you.
You are really speaking of a big issues here in the UAE, the polypharmacy. That completely every day we are dispensing a huge amount of medication. I'm thinking how really are the patients really taking all these medications? And to be honest, most of 90% they are not taking it. They will be coming at the end of the pharmacy when the medication are near expiry, they will return most of the medications. They will tell me, we really don't need these medications. So this is something we have to, between first, sometimes it's related to patient mentality. Some patients really convinced if I have more medications, it will be better for my health, even if I'm not using, but it's some kind of psychological thing. More also, it is related to the physicians themselves, the practice of prescribing. We tried here in the UAE to the IDs to decrease the duplications of medication, the polypharmacy. So this issue is not just individual. We have to tackle it from individuals, and us as a pharmacist, how to communicate this to the patients. The practice of going to different health cares and hospitals and collecting different medications. So this is one of the things that it is not a complicated issue that is not especially for geriatric. We have to really be very cautious when we are dealing with them and how we make them understand the impact of medication. Do you really understand how these medications are affecting yourself before it's affecting the environment itself? So this is, I think, it's awareness and in all the levels.
Thank you so much, Dua. That was very helpful. I think this question also has a sub one. Dua, if you also want to comment on that one as well, or Mina, if you can also make a comment. What simple tools help assess environmental impacts in routine AD medication counseling, and how they adapt for resource limiting settings like rural India? Mina, Dua, Rafa, who wants to go?
I think this
can
is
you
a
repeat
hard
the question?
Oh.
Yeah, what simple tools help assess environmental impacts in routine medication counseling, and how do they adapt for resource limited settings like rural India? So case study more of like the developing country, maybe like India or maybe in Africa or somewhere, to give a context.
I'll go first. I think this is a very difficult question because it highly depends on a local context, how the pharmacy operates or a healthcare setting operate. For example, if every different country, I'll give an example of France. They are managing the supply chain of medicines and medical devices, where in the UK, pharmacists do not manage medical devices. So immediately there is your problem of, the audit tool tailored to devices and medicines. So that's different. In UK, we have a big problem with pressurized metered-dose inhalers. Everybody they're addicted to the blue inhalers, whereas this is not a problem in the Scandinavian countries. For example, they use more dry powder inhalers, which are more environmentally friendly. So it highly depends on the local context of the pharmacy practice. And same as Dua, we see people in the UK as well. They love polypharmacy. I'm entitled because they don't pay. So I'm entitled to all these, and I can keep it in my house. And then if I don't want it, I'll just return it to be binned. So it's that the behavior change is really hard. And I think, if anything, is to negotiate your soft skills to negotiate for change. That's something that I think your counseling skills, your personal skills to work in a team and be a team player. Do not underestimate that in terms of sustainable pharmacy.
Thank
I
you
will
so
add also for
much.
that in low income countries, the main issues really is the antibiotic abuse, which is one of the main things that affecting and causing all the antibiotic resistance. In the pharmacy level, if we are not giving proper counseling and they are taking, because most of them, they cannot go directly to the hospitals, they will prefer just go to the pharmacy and take antibiotics, and they will give them there in most of the African countries and Indian countries. So here is come the pharmacist role. If every time we are giving these patients antibiotic, we are really causing a serious antimicrobial resistance issues, and it's impacting the environments. So this is one of the things that is in the countries.
Thank you so much. We're almost running out of time, so we'll just go straight to 30 seconds from each panelist before we wrap up. So Rafa, do you want to go first? 30 seconds, final words.
Yeah, I just before that, I just want to tell our colleague from India to check the guide. We have a section there about the clinical practice and community pharmacy. So thank you so much, everyone. It was really a pleasure to have all this number of people gathering to to make our community more greener and sustainable. I hope this guide, many people will find it useful and practical. And yeah, thank you for everyone joining today.
Thank you so much, Rafa. Mina?
Thank you all.
Mina? Not Lizette. Mina, final words, please. 30 seconds.
Thank you all for attending today. I think everyone is capable of change. I think in the words of Greta Thunberg, there's no one too small to make a change. Don't underestimate your power to drive the sustainable change.
Thank you so much, Mina. And Dua?
Thank you, everyone. And I will tell you, act today. Only this is what I have.
Thank you so much, three wonderful panelists, for your insights, contributions. That was quite very much exciting and very, very much knowledgeable as well. So thank you so much to a few. We hope to engage you further for future digital events in sustainability in pharmacy practice. So thank you so much. So so to wrap up and conclusions, next slide, please, Ruben. Okay, so we have, of course, FIP has future FIP digital events coming up. So if you want to in terms of schedule your calendar invites, reserve your spots for upcoming webinars, so go to our website, events.fip.org, be able to see our upcoming webinar. We usually schedule this once throughout the year. So check out the ones that are upcoming that will really be more beneficial to you. Okay, so I also want to use this opportunity to let you know about our next year's FIP World Congress. So this year was in Copenhagen, Denmark. So next year will be in Montreal, Canada, from the 30th of August to the 2nd of September 2026. The theme is One Health, One Pharmacy, Bridging Science, Practice, and Education. As you can see on this slide, we have the QR code. So if you want more information in terms of how you register and how you participate, please scan the QR code. And then the sub-teams for this conference, our Congress next year will be three. There's three sub-teams. First one is integrated health, pharmacy, advancing well-being through a One Health approach. You have the one on innovation with purpose, innovating with purpose. how we drive change through science, education, and practice. The third one is collaborating for equity, strengthening global impact through partnerships and inclusion. So it's very important to note these days for those who want to be actively participate next year. So we have the abstract submission deadline, and which is 18th of March 2026. We also have then, of course, after you submit your abstract within this deadline, then by 17th April, you get to know the feedback from your abstract, whether they're selected or not in terms of how you engage, different types of abstracts. And then for the conference registration proper, we'll have the early registration fee deadline. So if you want it for early birds, they register at a discounted rate. So 3rd June 2026. And then for the second registration deadline is 12th August 2026. So it's important to note these deadlines and of course these sub-teams in case as well you want to submit a session proposal for upcoming conference. Next slide, please. So in that regard, thank you so much once again for taking our time to attend our webinar from anywhere you are from. Thank you so much. We hope that you find it quite insightful and also be quite helpful in your area of practice. So thank you so much. Once again, good morning, good afternoon, good evening for when you're joining us, and have a wonderful rest of your day. Thank you once again to our panelists and to our FIP crew.